All right, the U.S. athletes competing in the Olympics in Rio are taking every precaution not to contract the Zika virus. They've got mosquito netting, mosquito-proof clothing, and bug spray galore, which are normal precautions compared to some of the athletes from other countries. But the American athletes are also facing jeers from the crowds about their fear of the virus. Take a look.
The Zika jeers came in response to photos Solo tweeted showcasing an arsenal of anti-mosquito repellent she brought to Rio. "If anyone in the village forgets to pack repellent, come and see me," she wrote. Hope also shared this photo wearing a bandana and an anti-mosquito bonnet while holding a huge bottle of repellent. The crowd clearly thinks she's overreacting.
Joining me now is family physician, national certified counselor, and sexual health relationship expert, Dr. Jonathan Vitale. Dr. Vitale, thanks for being here.
Thank you, Liz. Thanks for having me. It's a pleasure to be here.
All right, doctor, I got to say, I actually find that quite funny that they were yelling Zika at Hope Solo. It's clever, it's funny. But what is the risk, in all seriousness? What's the risk of the Olympic athletes bringing the Zika virus home from Brazil?
You know, Liz, the risk is there, but I don't think it's as large as we think it is. So Zika can be transmitted sexually and also from those mosquito bites. So the biggest risk is if folks were to be infected with Zika, come home to the U.S., have unprotected sex, or have a mosquito that bites them when they're at home and then bites somebody else. So a very small chance.
Right. And do you know what the procedure is for the Olympic athletes when they come back home? Are they going to be screened and tested to make sure they're not bringing it back?
I'm not sure of any plan to do that yet. Really the recommendation from the CDC, however, is that folks who are coming back from areas infected with the Zika virus, such as Brazil, abstain from unprotected sex for 8 weeks. That's really, really important. But that's all that the CDC is suggesting currently.
All right, and that's just exclusive to the U.S. There are hundreds of countries in Rio for the Olympics. How are we as a whole, the World Health Organization even, how are they preventing the international dissemination of Zika?
That's a really good question. And you know what? I don't think there's enough attention and enough leadership in that regard. I mean, certainly in the U.S., we are much better equipped than other countries at preventing Zika. Simple things like we have more air conditioning here, we have less standing water, we have better access to health care. But there doesn't seem to be that leadership on a worldwide level that's helping to prevent the spread of Zika even further, which really is a global issue.
Right, and doctor, you deal with this issue every day. You deal with women with Zika every day. What are you seeing?
Yeah, so here in New York City, we deal more so with patients who are concerned about Zika, who are trying to get pregnant. That's the biggest pool. So women who are going to these other countries, or even here in parts of Miami, who then come home, they have no symptoms, but they're worried about conceiving and they want to know what to do. And more importantly, most of these people, they want to get screened, they want to get tested, but the Department of Health is really discouraging that unless they have symptoms. So that's kind of the conversation I'm having day in and day out with patients, especially women.
And how quickly do you know if you're infected, if you contract Zika? How quickly does that manifest, or how long is that dormant in your body before it manifests?
That's a good question. It's usually within 1 to 2 weeks. But what's really important to point out here is 80% of people infected with Zika do not have any symptoms, and they don't know it. And even if they do have symptoms, it's very, very mild. It's very easy not to know you have Zika and to transmit it to other people sexually, or of course the biggest concern is mothers transmitting it to their fetus.
Right, of course. I think everyone's fear is the microcephaly, the brain birth defect that the babies are born with sometimes. But that's a very interesting statistic. 80% of people who have Zika either don't have any symptoms or very mild symptoms. What percentage of those with symptoms, those 20%, what percentage of those have babies who have birth defects?
You know, that's a very, very small number. I want to really hit that point home. That is in the single digits, or less of a percentage of people who actually transmit the virus to their babies. It's anywhere from 1 to 10%, depending on what source you're reading. But it's a very small chance, even if you have Zika, to spread it to your fetus.
Doctor, in your professional opinion then, is the Zika virus being overblown? The fear, the funding, all those different things? Is the idea that the Zika virus could be the next pandemic, is that exaggerated?
Well, that's an interesting question. What we have to realize is in the past, we've had West Nile virus, we've had dengue fever. These have impacted many more folks than Zika virus does. I think it's those photos that have been, surfacing of the microcephaly, which is a detrimental diagnosis to a child and which costs millions and millions of dollars throughout the life of that child to take care of them. That's what's causing all this panic and concern. And I think it's warranted because we have to protect these and prevent this from occurring. Especially impacting children, we really have to prevent it. So I do think that there's a lot going on right now between Congress and the White House in this political battle over funding. And I think that Congress is playing a little bit of politics with the American health, and I think that's an issue. So I do think this is a big issue.
Right, and that's an issue we've seen in the last 7.5 years, politicians playing politics with our health. Yeah, but a lot of the state governors, Florida Governor Rick Scott, Texas Governor Abbott, they're asking for federal government funding to help research and fight the Zika virus. What do they want to do with that funding?
Well, so the most important thing, everybody would love to have a vaccine, of course, which is going to take longer than we'd like, but preventing the transmission of Zika and also doing more research on it and hopefully coming up with a vaccine within the next year. Those are the main things they want to do with that funding.
Right, and I also read this interesting story that said that scientists are working on a genetically modified mosquito that would be released, and it would somehow, I guess, fight the mosquitoes that were infected with Zika and take over that population. Doctor, how does that work?
Yeah, so that's a new thing that just came out. That they're working on these mosquitoes that can actually alter the genetic material of the infected mosquitoes and really reduce the transmission by about 90%. This is most important for this thing we all are worried about, which is local transmission here in the United States, which we're seeing in a handful of cases in the Miami area, and that could really be a game changer. So we're awaiting to hear more updates on that, but that would be a wonderful thing.
In your opinion, is that worth the money, and could that be used for other things transmitted by mosquitoes, not just the Zika virus?
So that's an excellent question. I think that right now Zika is a very quote-unquote popular illness. There's many other diseases in America and in the world that we really need to draw attention to, but right now this has the most press, and of course it impacts children the most. So is there room for this funding to be used for other things? Absolutely, but unfortunately that's a much larger debate and one that we can't talk about in just a few moments.
Right, and this is a more pressing issue right now. Dr. Vitale, thanks so much for your expertise on this issue. It was great talking to you. Our next tipping point with Kevin O'Brien is the war on coal. Stick with us, we're back in a minute.